Today, Utah's Nutrition Care Services team will prepare and deliver over 300 fresh, hot, custom lunches to inpatients all over the hospital, all at the same time. To accomplish this feat requires a very lean operation, and it's practically invisible. It all starts at the kitchen's daily huddle, where the entire team gathers to discuss things like software updates or menu changes, anything new or special about the day's work. Okay, it's about 9 a.m. Chris, a Nutrition Care Services rep, is on his unit. His patient is almost done with breakfast, and Chris is here to take his lunch order. Chris's tablet is loaded with our entire menu, but it can also handle custom orders so patients get exactly what they want. Well, maybe not exactly what they want, because as a safety measure, the software interfaces with Epic to notify reps of any patient diet restrictions. The diet clerk prints out individual tray tickets, which act as quality control checklists to ensure patients get what they ordered. When all the lunch orders have been gathered, the software will aggregate that information into tallies. A tally is just a summary that informs each food prep station what it needs to make for lunch. But the tallies haven't arrived yet, so how do these cooks know what to make and how much? They're data-driven. They've started building up the inventory based on historic data, and when their tallies arrive, they'll finish it up just in time to match today's data. You probably noticed that our kitchen is very clean, tidy, and well lit. It's also very agile. Notice the overhead power everywhere it might be needed, and that much of the heavy equipment is on wheels. The agility that's built into this workspace allows the kitchen team to easily experiment with new layouts and enhance their workflow as demands change. Let's go in the pantry where the cold food's prepared. The entire workspace is refrigerated to 37 degrees. This maintains freshness throughout the process and eliminates hundreds of unnecessary steps each day, because carrying food around doesn't make it taste any better. There are 4 pods in the kitchen. Pods are workstations where the cook's work and the rep's work converge, where batches of prepped food become individual custom lunches. At 11:15, podding begins. Here's Riker, a cook, and Ian, a unit rep. Ian took these lunch orders earlier and now is in the pod assembling those meals. Trays are dressed with drinks, condiments, and silverware, and then the food, prepared moments earlier, is portioned onto plates and covered to maintain temperature. Voila, that's lunch. And Ian knows it's right because he checked it against the tray ticket. And like every rep, Ian owns a unit. He has the same customers for breakfast and lunch, and when he delivers lunch, he'll tell each patient who the dinner rep will be. Great customer ownership. Here's Chris stocking a pod, supporting a fellow rep working for her customers. The kitchen has more than 4 reps, but it only has 4 pods. While the other reps wait their turn in the pods, they help manage variability by acting as runners for odd items like coffee or a pastry. Reps don't help each other out just to be friendly. It's standard practice in the pods and on the units, all in the name of speed. The whole process is fast, but it's not rushed. It does not feel like over 300 meals are being produced right now, but they are. This is the beautiful irony of a lean system. Considering all the information and product flowing in this tight space, in this limited time, the environment is very calm, very low stress. Here's Chris again, back on the unit delivering his customers' lunches. Patients are eating, but the process isn't done. When patients finish, reps take those carts to the dish room. There in the dish room, team members sort the stuff into 4 categories: linens, items to be cleaned, hard trash, and pulpable garbage. The pulper is a cool innovation. A run to the dumpster is a quarter-mile round trip, and the pulper cut those trips by more than half. Dishes, trays, glasses, and silverware are loaded onto a machine that can wash, sanitize, and dry, all in one continuous flowing process. The same dishes that carried 300 lunches will be back in service carrying 300 dinners later tonight. Thanks to this quick turnaround, the kitchen doesn't dedicate any space to dish storage. There you have it. Patients are full and satisfied, unaware of the lean process behind the scenes. Meanwhile, the kitchen team is already working on dinner.